So at this ASH meeting in 2023, I have presented a poster from the European Myeloma Network. It's a EMN19 study, which is a phase 2 prospective study encompassing patients who are diagnosed with extramedullary plasmacytoma. And the treatment is Daratumumab combined with Bortezomib, Cyclophosphamide, and Dexamethasone in the CyBOR-D type of regimen. And this is a unique study. It's the first study which has been completed in this highly unmet need of patients. And when it was planned 5 years ago, prior to the pandemic, CyBOR-D was the best regimen that could be applicable to this kind of patients. It's prior to the bispecific and the CAR-T era. And so initially we were not planning to have a good recruitment, and we were aiming to include patients who are newly diagnosed and in their first relapse. But eventually it was possible to recruit quickly, and so we limited the study to newly diagnosed only, and with 40 patients who were enrolled, and the study is designed to have 3 years of treatment with Dara-CyBOR-D continuously. And we have now currently 23 months of follow-up, and 2/3 of patients being newly diagnosed, and again 2/3 of patients having only soft tissue or with paraosseous disease. So only 1/3 is paraosseous disease. So it's a highly high-risk patients. And we have now come to see that the overall response rates are above 80%, and half of these are complete response. And also we have observed among 42% of patients MRD negativity. At this Congress, for the first time, we are presenting the impact of combining the complete metabolic response with the marrow MRD and its impact on outcome. And we have seen that the progression-free survival among those who achieve both complete metabolic response and also complete response in the marrow, they are doing the best with a PFS almost more than 95%. But those patients who have either one of those, they do inferior, and the worst are those who don't achieve any of these remission category. So this is the first time in an EMD disease, the impact of achieving a metabolic response and also the standard response criteria is being presented. The value of this study may serve as a reference study for new studies in future that has the same patient profile. And since there is, for instance, another study which encompassed the Dara-CyBOR-D regimen in newly diagnosed patients, and that study includes the LYRA study, includes only patients with all incomers. We are able to compare the EMD study with that one, and for future those patients who are newly diagnosed with EMD, this may serve as a reference study.